Hey, welcome. So, clinical supervision is something that all of the clinicians affiliated with our site are happy to provide. We have to restrict that to practitioners who are already independently licensed. Navigating the bureaucracies of all 50 states and abroad does not appeal to us. So, we're happy to support the new and experienced practitioner alike, but we do so in a consulting capacity and in a coaching capacity. So, in a consultant capacity, we're more than happy to talk about cases, maybe a long term client that you're just kind of stuck and need a fresh perspective or a new approach to go in. That being said, we prefer to focus on the practitioner. Our experience is that case review is perhaps the most overrated aspect or benefit of clinical supervision. We would much sooner check in with you and challenge you in terms of how are you doing at taking care of you? Are there connections between the work that you're doing clinically and struggles that you're having personally? I think honestly, there's a very fine line between what is great clinical supervision and what is great therapy. And so, for myself and for the folks that I'm affiliated with, we're going to challenge you. We're going to push you really hard to look at how does the work that you're struggling with connect to your past experience? How does it affect and being affected by your life presently? Are you doing a sufficient self care? Are you doing everything that you need to be doing to advance yourself personally and professionally? So we are not for the faint of heart. We're highly skilled and experienced clinicians. We're very good at getting results. But working with us in that capacity is something I'd only recommend if you're really geared towards growth and looking at what needs to change in your practice. I know most of the clinicians that I've supervised over the years are very uncomfortable with self promotion, and so that often yields disappointing results in terms of caseloads and the success of your practice. But more than anything, I know that whatever we struggle with clinically has some type of personal connection. And so we'd be happy to explore that with you in whatever way works best for you. Happy to do that by email, by video conference, happy to do that by phone call. Let us know what works best for you. Drop us an email and we can start that conversation about promoting your good health and your best practice.